Hello everybody, welcome to my YouTube channel. It's your girl Lilian Momina, and today I want us to discuss about taking care of the vagina postpartum. If you're here and you've just had a baby or you're pregnant, congratulations, and let's take care of the vagina. So postpartum period is basically the period between the first day you're coming out of delivery room until around the 12th or to 14th day. That is the postpartum care that I'm going to talk about. So what are some of the things that you need to understand? You need to understand that you have just had a baby, so let's take care of them. It's to retain the reason why you want to ensure that you take care of your vagina very well after childbirth is to maintain and restore the elasticity that was there. We all understand during pregnancy there are changes that come about that may affect the vagina. One of them, there is an increase in blood flow, blood volume and blood flow, and definitely this will affect the vagina because the capillaries will get more, and so you become a bit sensitive. When you're pregnant, you get easily aroused and all that. And then there's also your estrogen levels go high, so with the increased volume, the high estrogen and progesterone levels, there's also increased discharge. This is normal. Just make sure that it doesn't have a foul smell and it is not green, yellow, or those of colors, or black, or having stains of blood on it. So if you have any of these signs, please go get checked, and if you have any sort of infections, please get treated. The vagina can appear a bit like swollen because of the increased blood flow and volume, so that is not something to worry about. It is very normal. You also become a bit more sensitive. You can easily get a tear down there, so you need to make sure that you just practice safe sex and make sure that your hygiene levels are well maintained during pregnancy, and to make sure that you try as much as possible. You do your hydration properly, you do your vegetables, you sleep well, you do cotton panties if you can. When you're pregnant, let it air so that you avoid infections and all those. And then don't douche at all. Don't douche. Avoid the feminine washes, all those, avoid them. And if you have any sort of infection, please get treated, because infection when you're pregnant, they can be very, very risky. They can cause miscarriage, they can cause preterm birth, they can predispose the baby to have low birth weight. So you want to make sure that the pregnancy outcome is as healthy as it can possibly be. So you've given birth, congratulations, you've gone through the process of labor, you've had maybe a vaginal birth. So what are some of the ways that you can take care of your vagina? First things first, make sure that you get the maternal pads, the maternity pad, the mother pads. They are a bit big, they might be a bit uncomfortable for that reason, but make sure that you use them, because the blood flow when the first few days, it is it can be heavy. So make sure that, and then also monitor this blood flow, because it's supposed to be higher on the first days, and as you go by maybe to day 7, it's supposed to be going down. So if it doesn't go down, or if it increases, it is an alarm. So you need to make sure that you go get checked, or you call your practitioner to confirm, and also consult, and also get checked, so that you don't overbleed or something like that. Maybe you got a rupture or something that was not detected during childbirth. Make sure that you monitor your progress, monitor how your blood flow is during those first few days, and then change as frequent as you can. If you can also add cotton, dry cotton that is clean. You can make sure that to ensure that area remains dry, because again, we don't want to increase moisture. Moisture creates a hub for infectious diseases, infectious agents like maybe yeast, bacteria, and all that. We want to make sure that that area remains as dry as we possibly can. I know it's a bit hard with the blood coming out, but just make sure you change as frequent as you can. Also make sure the panties or the undergarments that you're using, they are of good cotton, and they are stretchy, and they are not so tight. And avoid all those feminine washes. What you can do to clean that area, you can do a sitz bath. It's after delivery, it's even difficult to bend to pick something. So for most women, they'll find it even difficult to take a bath or take a shower. So what you can do to make sure that because you don't want that area with any infection. You see, you're on pads like 24/7 for the first few days, and you're bleeding heavy, so you don't want to get any infections down there. So you want to make sure that you clean that area as best as you can possibly do. So the easiest way that you can do that is sitz bath. Don't be in a hurry. Don't sit on the sitz bath immediately after childbirth. It can be a bit painful, because let's say if you had an episiotomy and you do maybe hot water with some salt, it is not it's a bit painful. But just maybe the next day, just make sure you clean with warm water the first day. Then the next few days, when you're able to sit down, maybe after 72 hours, when you're able to go lower to do a squat, or to do a squat, because bending a bit is a bit hard because of the back. When you're able to do a squat, take your warm water, add some salt, add some herbs of choice, then just sit for 10 to 30 minutes, relax. It's also a good way of relaxing. If you can't do it when the baby is asleep, relax a bit. You can read a book, you can watch an episode of a show, you can talk to a friend. Just make sure you do something that is relaxing. What else? Make sure that you can also do Kegels. You see, on the 3rd trimester, the body starts preparing for the birth, and vaginal birth is the most natural form of birth, the way that God created us. So the body starts preparing to expel that baby through the vagina. So the elasticity of the pelvic floor goes down, so you lose muscle tone in the pelvic area. So whether you had a C-section or a vaginal birth, it's always advisable to keep off penetrative sex for maybe at least 2 to 6 weeks. Just keep off, give yourself time to recover and restore your elasticity. Do your Kegels, right? This you can do even when immediately, like when you're done with childbirth and all, you can start with them as soon as that time. So make sure that and then also alternate with the breathing technique to make sure that you get enough oxygen in that area. And then also we want to increase your minerals and vitamins like the calcium, magnesium, copper, all this collagen and this. You want to ensure that the minerals and vitamins, nutrients that you're taking, they're promoting elasticity and elastin, the fibrin, protein and all that, so that you also make sure that as you do your Kegel, so that you nourish it, you're also nourishing your body well, to make sure that you provide all those nutrients for the promotion of creation of the tone, the muscle tone down there. So do your Kegels religiously, and once you start feel maybe you can walk here and there, you can do some squats here and there. Just listen to your body. Don't do something in a rush. Take your time, listen to your body. And then always the mantra I always tell people, always do anything gradually. Even if you are working out before pregnancy and now you've given birth and you're thinking, oh my God, I want to go back to working out. You have to take your time to build your muscle, to build your momentum, to build your stamina to get to where you are. So make sure that you start gradually. Start gradually. Make sure that you do it slowly but surely. So you can start once you've started like healing here and there. You're on week 6 or week 4. You can do some pelvic floor muscles. You can do like glutes. You see, when you're doing these muscles, you can also be working on exercises that to heal on the lower tummy and the back. There's the breathing techniques, the lying low. You lie down, less movement, like low intensity workouts that do not engage so many muscle tones and all that. And then you make sure that you strengthen that pelvic floor. Then when you start sexual intercourse, be gentle. Talk to your partner, let them be gentle. If you see, when you're breastfeeding, again, your estrogen levels go down, so that and then this in most cases will make a woman or a mother dry during sexual intercourse. If this is the case for you, don't worry, don't panic. Don't start using these crazy products. You can use a neutral lubricant just to lubricate that area, because again, you want to minimize tears as much as you can. Predispose yourself to rough and hard sex, because you will tear down there and it is a problem, and we want it to heal. We are still trying to naibembeleza. We are still trying to make it heal faster, so we don't want to bring tears up. So let's be easy on ourselves, and then all the best. Enjoy motherhood. Motherhood is a beautiful journey. Let me know if this video helped and what we would want us to discuss about. Thank you for listening, and bye.